For today's video, we are going to talk about an athletic taping technique called the thumb spike. So if you are interested, just keep on watching. So let's talk about the athletic taping. It was a process of applying the tape directly to the skin or over a pre-wrap in order to maintain a stable position of bones and muscles during athletic activity. The purpose of athletic taping is to limit the range of motion of a certain muscles and joints to help the body to heal faster versus if the movement is not restricted. It can also serve as a splint for sprained joints, which help the injury to heal at a much faster rate as well. It can also help to prevent injury caused by exercise, but take note that it can only prevent the injury, but unfortunately, injury can still occur. It was the most common method used to prevent injury, especially among athletes. In this video, we are going to focus on athletic taping technique called the thumb spica taping. This taping technique will limit the movement in the joints between the thumb and the hand to help the soft tissues to heal after a thumb sprain. In this technique, it uses loops of tape around the thumb that attach to the wrist and bring in the thumb to prevent it from moving. So now, I will teach you the step-by-step procedure on how to do a thumb spica taping. So without further ado, let's get started. So I have here a 1.5 inch of Muller athletic white tape, but for thumb spica, we only need a ½ inch of it, so we will tear it into half. By the way, in cutting off this athletic tape, we will not use any scissors, so you should learn how to tear it off using your hands. There are no specific position of hands in tearing it off. It's up to you. It depends on your comfortability. All you have to remember is that the force should come from your elbow and not from your wrist. So in my case, I tear it off in this. So first, I hold the tape in my desired length with my left hand. So I pinch the tape using my thumb and index finger. Then using my right hand, I will also pinch it, then slightly pull it towards the right to distract the tape, creating a little space between the cloth pattern of the tape. Then I will hold this spot tightly with my left hand. Then using my right hand, I will pull the tape towards me. Then that's it. So like what I said before, in this technique, we only need a ½ inch of the tape. So we will need to tear it off into half. So like this. If your patient has a hairy and sensitive type of skin, you need to use a pre-wrap before applying the athletic tape. So here is what a pre-wrap looks like. So it's like a thin foam strip, which is very soft and stretchable. Since my patient here has a normal skin type and does not have any hair in his wrist and hand, we don't need to use pre-wrap. Our patient hand should be placed on the top of a table and in a midline position like this, and thumb facing towards the side so that it will create a space between the thumb and the index finger. So we should put a piece of towel or a small pillow under our patient's hand to make sure that he was comfortable in his position. We should start taping using a 1/2 inch of Muller white tape from the wrist of the patient, then around it. Then we will move upward towards the thumb. Around it, then crossing in front the metacarpophalangeal joint of the thumb, then going down, then we will go around to the wrist back to the starting point. Then from here, we will follow the first pattern, but we will slightly move the tape to make another layer. Then around the thumb. It should not be that tight, so that we can still allow circulation around it. Then we will move downward again, then around the wrist, going back to the starting point. Then we will move again upward, making another layer. Then around the thumb. Then we will encircle it and go back to the starting point again by encircling the wrist of the patient. And then we will cut the tape here. Then using a full 1.5 inch of Muller white tape, we will secure our taping by encircling the full tape, a 1.5 inch of tape, to the patient's wrist. Then cut it out. And then we're done. Thumbs up. Disclaimer: this technique will be helpful for light thumb sprains and in situations where patients can't wear a brace but still need to give some support to the thumb. If you need to give a complete immobilization of thumb, using a splint or brace may be more effective than using a tape. So that's all for today. I hope you learn a lot. See you on my next video.